morning, respected panelists and all the dignitaries present here. Myself, Debarnab, honored to stand before you to present a paper on the topic, fatty liver, a risk factor for rising intraocular pressure. So in this study, we explored a growing concern in both ophthalmology and hepatology, that is whether fatty liver serves as a risk factor for rising intraocular pressure, which is a critical marker and the only modifiable risk factor for the development of glaucoma. Glaucoma, which is considered to be a silent thief of sight, is responsible for 12.8% blindness in India. In a study conducted in Japan, it was seen that 10% of patients with elevated intraocular pressure but without visual field defect newly developed typical glaucomatous visual field defect during 9 years of follow-up. Fatty liver, on the other hand, is linked to metabolic syndrome and lifestyle changes, and the patients with fatty liver diseases are predisposed to a myriad of systemic conditions which may cause rise in intraocular pressure both directly or indirectly. In a recent study conducted by AIIMS Delhi, it was said that 38% of Indians suffer from fatty liver disease. By identifying the connection between these two seemingly unrelated conditions, we aim to broaden the scope of preventive care and clinical intervention. The primary aim of our study is to assess whether a patient with fatty liver disease shows a correlation with intraocular pressure with an objective to estimate the association between change in intraocular pressure and severity as well as etiology of the fatty liver disease. With these objectives in our mind, we have conducted a cross-sectional prospective study in Silchar Medical College and Hospital across a span of 3 months from January 2024 to April 2024, under which more than 400 patients were randomly selected who were diagnosed of fatty liver disease by the help of ultrasonography, and any grade or any etiology of fatty liver disease and the patients aging more than 18 years of age were included in the study. Among them, the patients who were already diagnosed of glaucoma or were suffering from uncontrolled systemic illness and the patients with scarred cornea or non-consenting were excluded. All the patients underwent Goldman applanation tonometry for intraocular pressure measurement of both the eyes during the OPD hours. Coming to the data interpretation and analysis, as we can see in the table here, 403 patients were included in the study, out of which majority of them belong to the group of grade 1 fatty liver disease, followed by the grade 2 and grade 3 respectively. Moreover, what we can see here is the spike in the number of patients between the age group of 40 to 60 years of age. The first graph here shows the mean intraocular pressure of patients in different stages of fatty liver disease. As the graph depicts, the mean intraocular pressure of grade 1 fatty liver disease patients stand at 15.5 mm of mercury, with that of females being 15.4 mm of mercury and that of male being 15.7 mm of mercury respectively. Similarly, patients with grade 2 and grade 3 fatty liver disease patients had mean intraocular pressure of 16.4 and 16.6 mm of mercury respectively, therefore showing a linear rise of intraocular pressure with increasing severity of fatty liver disease. Also, the mean IOP of male subjects tend to be on the higher side than that of the female subjects. In the second figure depicting a bar graph between the mean intraocular pressure and the etiology of fatty liver disease, the mean intraocular pressure was found to be 16.2, 16.3 and 16 mm of mercury in patients with fatty liver disease due to alcohol, non-alcoholic fatty liver disease and fatty liver due to infective etiology, noting not much difference among themselves. So, to summarize the findings of the study, the mean intraocular pressure of the patients with fatty liver disease is on the higher side as compared to that of the mean intraocular pressure of the Indian rural population, as was seen in the study conducted by Vijaya et al. With increasing severity of fatty liver disease, linear rise of intraocular pressure is seen. However, no significant association between mean intraocular pressure and etiology of fatty liver disease can be determined because of the insignificant difference of mean intraocular pressure among defined etiologies. The findings of this study are supported by the retrospective study conducted by Jun-Hyuk Lee et al. To conclude, fatty liver can be postulated to be a risk factor for rise in intraocular pressure. Fatty liver disease can be an underestimated risk factor for rise in intraocular pressure, putting patients at greater risk for developing glaucoma. As both these diseases are irreversible, early detection and prevention stays the key. Therefore, a multidisciplinary approach is recommended, involving ophthalmologists and hepatologists to develop an integrating screening protocol. However, given the preliminary nature of our study, we believe multicentric case control as well as cohort study is the way forward so as to have a better understanding on this subject and validate the relationship between the two systemic conditions. And once the relationship is established, interventional study can be conducted to understand the mechanism behind the rise of intraocular pressure in fatty liver disease patients. These are the references that I've used. That's all I had to present. Thank you.
Thank you. Any questions, please?
What made you to do this study? Like, why do you think like fatty liver and IOP can be associated?
Actually, madam, we thought that both the diseases like glaucoma and fatty liver disease of their own spectrum are irreversible, and both of them share most of the risk factors are shared among themselves. So,
Sorry? Most?
and both of them share common risk factors, ma'am. So we thought that there might be a correlation between these two, ma'am.
What common risk factors you think this here?
Like, ma'am, age. With increasing age, both the incidence of glaucoma and fatty liver rises, and
Age is though like it's a common for all all diseases. Anything else?
then, ma'am, metabolic risk factors like, ma'am, hypertension, diabetes, and with lifestyle factors like alcohol intake, smoking, all these risk factors are common in both of them, ma'am. So,
Okay.
Just two questions, minor ones. What is the proposed mechanism? Any relation?
sir, the exact mechanism is not known till now, but there are some hypotheses. The first hypothesis is that fatty liver induces production of pro-inflammatory cytokines, which induces atherosclerosis, and because of this, there may be loss of autoregulatory functions of the blood vessels. So there may be rise of the intraocular pressure.
Are there any etiological studies which indicate?
No, sir. Till now, there is no etiological studies.
Second is, how did you evaluate the fatty liver?
Sir, we have selected all the ultrasonography diagnosed fatty liver diseases who were already admitted in the medicine ward of our college, sir.
Did you do quantification? How much of fatty liver? 1 centimeter, 2 centimeters?
Sir, actually, we went with the grading of the fatty liver disease. Like in the radiology department of the our college has already diagnosed them as grade 1, grade 2, or grade 3 fatty liver disease. So we have compared the intraocular pressure with the gradings of the fatty liver.
Did you do a fibroscan in these patients or
Not available in our college.
no? Okay. Lipid profile, did you consider doing that also?
No, sir.
Okay.
Were they all alcoholic with fatty liver?
No, ma'am. Yes, ma'am. We have divided them into 3 groups: alcoholic, non-alcoholic, and due to infective etiology.